Hello, my name is Gala Hughley. I will be an 11th grader at Shaker Heights High School in the fall. This summer, I did a presentation on nursing compliance with Foley securement devices, and I was at Euclid Hospital for the Science Internship Program for Nursing. So a Foley catheter is a medical device that is used throughout many hospitals for patients who cannot urinate on their own. The device is inserted up the urethra and in the bladder. A bubble forms once inside the bladder. In this bubble, it basically holds the Foley and keeps the Foley from moving inside and out the urethra. So the catheter is usually kept in the patient for more than 24 hours, and this can lead to infections if left in too long and the catheter is not secure. So on the right, there's a picture of a Foley catheter kit, and usually there's skin prep and certain procedures that you have to go through in order to insert the Foley into the patient. And on the left, there is a picture of the Foley being inserted into the bladder, and you can see the bubble forming. So the problem with these catheters is that it can cause problems to patients, such as catheter-associated urinary tract infections, also known as a CAUTI. This can happen if the Foley is not secured down, preventing movement of the tube. If the Foley tube does move inside and out of the bladder, the bacteria forms and that causes the infection. So in order to reduce the amount of CAUTIs in hospitals, it's important that the Foley stays secure and does not move in and around the bladder. There are securement devices that are placed on the Foley tube that indeed keeps it in place. There are a few different kinds of securement devices that we can use. However, there was a specific one that I used at Euclid this summer for my project. The one that I used at Euclid Hospital this summer is displayed at the right, the Foley anchor securement device that's on the patient. And then there are other types of securement devices displayed on the left, those three pictures. Those are also helpful. However, the one on the right is what I used. So my hypothesis for this project was if nursing compliance with Foley catheter securement devices is monitored and nurses are educated about the device, there will be an increase in the usage of the securement devices, thus reducing the amount of CAUTIs. So my goal was to increase the amount of nurse usage with Foley catheters, and in order to do this, I monitored nurse compliance with securement devices for 25 days. If the patients did not have on a securement device, the device would be personally delivered to the nurse responsible, and I would ask them to please put one on their patient. So I took my results and I recorded them onto data sheets each day that I did my rounding in the hospital, and also surveys were sent out to each nurse questioning their experiences with Foley securement devices, and the nurses were also educated about the importance of the device during a presentation at Euclid Hospital. By the end of the 25 days, a total of 333 patients were seen. So here are my results after rounding the floors and seeing which patients had the securement device. And as shown on the right, the behavioral unit had the best percentage of patients with the securement device, and that was 77%. And of those 70% 100% of those devices were in the appropriate place, and that is shown in the gray, and the percent with the securement device is shown in the blue. And also a note is that 33 of the 333 patients that were seen this summer, 114 of them had the securement device on. And some survey results to the question of how often do you use a securement device. 39% of the nurses said that they sometimes use a securement device, and it is important that nurses always use a securement device unless there is a specific reason as to why the patient cannot have one on. So as you can see, there's a percentage of the pie chart here. Always was 8%, usually it was 31%, sometimes was 39%, rarely was 21%, and never was 1%. Another question asked in the survey was, according to nurses at Euclid Hospital, the securement device is what kind of useful or how much useful, and most of the nurses said that it was usually useful, which was 34%. And it's clear that not all the nurses feel that the securement device is always necessary, which is why most of them did not originally have them on their patients. So after conducting research at Euclid Hospital, it was clear that the securement devices were not being used as often as they should have been. However, because I monitored nurses' compliance with these devices, there was a significant % increase in the amount of patients with the securement device on. On the first day of rounding the hospital, there was 50% of patients with catheters that also had on the securement device. By the last day of rounding, there was a 26% increase, thus making it 76% of patients with the device. This shows that my hypothesis was valid, and my monitoring was able to increase the nurses' usage of the securement devices. So it's highly recommended that further experimental research is continued in order to find out if the securement device actually prevented the patients from having a CAUTI. It is also important that securement devices be placed next to catheter kits in the storeroom, or that the devices be taped onto the actual catheter itself. Either way, this will help remind the nurses that the Foley anchor securement device is needed every time a catheter is present. So I would like to give a huge thank you to my mentor, Vicki Gardner, my peer mentor, Danny, and all the employees in quality management at Hughley Hospital, the Office of Civic Education Initiatives, and my parents for all their love and support throughout this summer and this internship. Thank you for the opportunity.